The impact of the Affordable Care Act on access, cost, and quality of healthcare. Healthcare in the U.S. is plagued by increased cost, decreased access, and across-the-board disparity issues. The Affordable Care Act is legislation that was introduced in 2010 by President Obama. The main goals of this national health care plan were to make healthcare affordable and accessible and improve quality and coverage of care. In order to improve access to care and coverage, several changes went into effect. Patients with pre-existing conditions were no longer allowed to be denied coverage or penalized for their conditions. Dependent children were allowed to remain on their parents' insurance plan until the age of 26. Medicaid programs were expanded in order to cover more people based on income. State health exchanges and co-ops were developed to provide a place for low-income, self-employed, and those with no insurance benefits offered by their employer to obtain health insurance coverage. Rules were put into place so that more businesses were required to provide health insurance. Medicaid is a federally funded program for people who fall at or below the federal poverty level. Medicaid expansion would be funded in part by state and federal governments. The coverage offered in the healthcare exchanges and co-ops would require participants to pay a premium. As the exchanges became more functional, the system was expected to become more self-sufficient. The exchange is an online marketplace that was created as a means to improve access to health insurance. Qualified individuals and small businesses can compare and purchase coverage offered by competing health insurers. The exchanges also help identify those who are eligible for Medicaid and other public programs. The coverage that is offered on the exchanges meets all of the specified reforms of the ACA. Exchanges also exist to certain low to middle income families with obtaining federally subsidized premium and cost-sharing assistance that reduces the cost of purchasing and using health insurance. States varied in their approach to implement ACA in the market reform. Reforms include access to coverage for young adults, a ban on pre-existing conditions, the coverage of a minimum set essential health benefits, and a ban on lifetime limits for healthcare coverage. Each state has been required to set up an exchange. In states without established exchanges, residents can shop for coverage through the federal government exchange. The institution of the Medicaid program in the conceptual framework of the Affordable Care Act is what defines how one impacts the other. The ACA was designed to be a correctional effort towards improving accessibility through expansive healthcare coverage. With the quality framework in Medicaid, the ACA utilized the available platform to introduce its effects. The Affordable Care Act introduced new provisions that expanded eligibility to help cover even more individuals under the low-income level. The Act also improved eligibility and enrollment requirements for children under the combination of Medicaid and the Children's Health Insurance Program, or CHIP. This is the first direct impact that the ACA had on the Medicaid program. There have been different levels of change in insurance premiums. While those with pre-existing conditions are experiencing decreased premiums and more comprehensive coverage, individuals in good health have had a slight increase in premiums. The slow rise in premiums has been related to the allayment of the health insurance tax, which is to be paid by insurers and significantly contribute to funding of the ACA programs. The health insurance tax is expected to go into effect, and insurance companies are expected to pass this expense on to customers by considerable premium increases in 2018. This table is a summary of risk and market stabilization programs in the Affordable Care Act. Healthcare reform in the United States is a political process. The establishment of the Affordable Care Act was a landmark achievement for President Obama, as it was the first legislation of its kind. There are considerable figures to show that increased accessibility and improved coverage have occurred. The current administration is trying to reform, repeal, or replace the Affordable Care Act in an effort to further improve national health care. Total national health care spending is already cause for concern in the U.S. Politicians are concerned that the ACA exerts significant pressure on the economy. Various cost projections have indeed indicated that the ACA will continue to lead to increases in healthcare spending as the years progress. The Affordable Care Act has, however, exceeded expected performance in improving healthcare accessibility to individuals who would not have otherwise been covered. This fact is supported by statistical evidence. The Affordable Care Act has helped to improve the quality of healthcare in several ways. The institution of electronic medical records has improved record sharing, increased the speed of care by having records easily accessible, and has made medication delivery safer. Decreased reimbursements for readmissions have prompted hospitals to dedicate programs to patients that are high risk for readmission, thereby improving their care. Also, hospital-acquired conditions have decreased based on consequences and incentives that were instituted by the ACA. There has been some reported increase in wait times with increased demand and ongoing caregiver shortage. The healthcare exchanges and co-ops were designed to compete with private health insurance agencies. The ideology was that the lower cost of exchanges and co-ops would drive costs down and create competition between private and government-offered insurance. The exchanges were not fully prepared to compete with private insurers, and the cost caused many participating companies to back out. This deleted any chance of healthy competition. Limited governmental financial support further impacted the function and success of exchanges. The Medicaid expansion, which was planned to improve access, became optional for states to complete when the Supreme Court ruled on the ACA constitutionality and limited the enforcement of Medicaid expansion by the Department of Health and Human Services. The Affordable Care Act of 2010 was developed with good intentions. However, the extent of the change and the funding required have been challenging. While some have gained improved access, others are experiencing increased premiums and out-of-pocket expenses. Some cannot afford the benefits that were established for their income bracket. Coverage is not as comprehensive and affordable as intended. Healthcare exchanges are unable to compete with private insurance. Decreased funding by the federal government has further hurt the well-intentioned exchanges. Reform is needed before the goal of improved affordability and access, as well as coverage and quality, can be fully achieved.